Hello everyone, welcome back. Social Security, SSI, and SSDI recipients, Medicare beneficiaries, and seniors living on a fixed income. These are 5 new changes and updates that you need to watch right now. Some of these affect how people receive their payments. Some affect prescription drug costs. Some affect Medicare Advantage approvals. And one update is especially important if you use a Direct Express card. So make sure you watch all 5 because even if one update does not apply to you directly, it may apply to someone in your family. Also, I am not the government and this is not personal financial or legal advice. I am simply breaking down public updates into plain English so you know what to check. Now, let's get right into it. Change number 1 is the Direct Express card update. Now, this matters for people who receive federal benefits on a Direct Express debit card instead of through a regular bank account. Social Security announced that the U.S. Treasury selected Fifth Third Bank as the new financial agent for the Direct Express program. New Direct Express card enrollments with Fifth Third Bank began in May 2026. But existing cardholders need to pay attention as well. If you already have a Direct Express card issued through Comerica, Social Security says existing cardholders will transition later this year or early next year. That does not mean you should throw away your current card. Social Security says if you already have a Comerica issued Direct Express card, you should continue using that card following the transition until the card expires. So do not panic if you hear Fifth Third Bank mentioned. This is about the Direct Express card program. It does not mean your Social Security, SSI, SSDI, or other federal benefit amount is automatically changing. Your action step is simple. If you use Direct Express, watch for official notices. Keep using your current card until you are officially told otherwise. And make sure your contact information is up to date. And be careful with scams. Do not give your Social Security number, card number, PIN, password, or banking information to someone who randomly calls, texts, or emails you. Change number 2 is about paper checks and electronic payments. Social Security posted that it plans to complete the full transition to electronic payments for beneficiaries this year. This matters most for anyone who still receives a paper Social Security check. Many people already get direct deposit or Direct Express. If that is you, this may not change much about your monthly routine. But if you, your spouse, your parent, or someone you help still receives a paper check, this update is important. Paper checks can get lost, stolen, delayed, damaged, or returned because of mail problems. Electronic payments are meant to make benefit delivery more secure and reliable. But I know some seniors are nervous about changing payment methods. Some people do not have a regular bank account. Some people do not like online banking. And some people have received paper checks for years. The key is not to wait until there is a problem. Your action step is to check how your benefit is currently being paid. If it goes to direct deposit, you are already receiving electronic payments. If it goes to a Direct Express card, you are also receiving electronic payments. But if it still arrives as a paper check, pay attention to official instructions from Social Security or the Treasury. Do not trust random phone calls or text messages claiming that your benefits will stop unless you provide banking information. Use official channels. Change number 3 is about Medicare prescription drug costs. Now, this is important because even when Social Security checks go up, Medicare costs, prescription, doctor visits, and premiums can eat into that increase quickly. There are 2 Medicare drug updates that seniors should understand. The first is called Extra Help. Medicare says Extra Help is a program that helps people with limited income and resources pay their Medicare Part D costs. That can include premiums, deductibles, co-insurance, co-payments, and other drug costs. For 2026, Medicare says people who get Extra Help generally pay $0 for their Medicare drug plan premium and deductible, up to $5.10 for each generic drug, and up to $12.65 for each brand name drug. That does not mean everyone watching automatically qualifies. But if you are struggling with prescription drug costs, Extra Help is definitely worth checking out. Some people may qualify automatically, including people who get full Medicaid, help from a Medicare savings program, or SSI benefits from Social Security. The second Medicare drug update is the 2026 Part D out-of-pocket cap. For 2026, Medicare says yearly out-of-pocket costs for covered Part D drugs are capped at $2,100. After that limit, you do not pay co-payments or co-insurance for covered Part D drugs for the rest of the calendar year. But the key phrase is covered Part D drugs. You still need to make sure your prescriptions are covered by your plan and that your pharmacy is in-network or preferred. So your action step is this. If you have Medicare drug coverage, check whether you qualify for Extra Help. Check whether your prescriptions are covered. And review your plan if your drug costs feel too high. Change number 4 is for people on Medicare Advantage. CMS finalized a rule that limits when Medicare Advantage plans can reopen and change a previously approved inpatient hospital admission decision. In plain English, if a Medicare Advantage plan approves an inpatient hospital admission, the plan generally has to honor that approval, unless there is an obvious error or fraud. Now this matters because hospital bills can be huge. If a senior goes to the hospital and the plan approves the inpatient admission, that approval needs to mean something. This does not mean every hospital bill is automatically covered. It does not mean you can ignore plan rules. And it does not mean that Medicare Advantage has no restrictions. But it does mean CMS is putting stronger limits around approved inpatient admissions and when those approvals can be reopened. If you are on Medicare Advantage, your action step is to keep copies of approvals, letters, notices, and prior authorization decisions. If something gets denied or changed, ask for the decision in writing and ask about appeal rights. Last but not least, change number 5 is for SSDI and disability benefit recipients. Social Security says it is transitioning medical continuing disability reviews from state disability determination services to a federal processing site called Disability Case Review. Now that sounds technical, but here's what it means. If you receive SSDI or disability benefits, Social Security may review your medical condition from time to see whether you still meet the disability rules. That process is called a Continuing Disability Review, or CDR. Social Security says this operational change does not change the eligibility rules for disability benefits. Now that part is important. The rules for who qualifies are not changing, just because the processing site is changing. But if you receive disability benefits and get a letter from Social Security, do not ignore it. A continuing disability review does not automatically mean your benefits are ending. But you do need to respond, follow instructions, and keep your medical information updated. So your action step here is very simple. Make sure Social Security has your correct mailing address and phone number. Keep track of your doctors, medications, treatments, hospital visits, specialists, and changes in your condition. And if you get a review notice, respond on time. Now, here is a quick bonus update for SSI recipients. Social Security says SSI recipients may be eligible for the Lifeline program, which can provide a monthly phone or internet discount of up to $9.25, or up to $34.25 for consumers living on tribal lands. People receiving SSI, SNAP, Medicaid, and other federal assistance programs may qualify. Households with income at or below 135% of the federal poverty guidelines may also qualify. So if you are on SSI and paying for phones or internet service, this is definitely worth checking. Now, quick recap. Number 1, Direct Express is transitioning to a new financial agent. Number 2, Social Security is moving further toward electronic payments. Number 3, Medicare Extra Help and the 2026 Part D drug cap could matter for prescription costs. Number 4, Medicare Advantage inpatient approvals are getting stronger protection. And number 5, disability review processing is changing, but the eligibility rules are not changing. And the bonus update is that SSI recipients may qualify for discounted phone or internet service through Lifeline. Before you go, comment below which benefit you receive: Social Security, SSI, SSDI, Medicare, or Medi-Cal. That helps me know which updates to cover next. And if this video helped you, make sure you subscribe, because I'll keep breaking down the newest Social Security, SSI, SSDI, Medicare, Medi-Cal, and senior benefit updates every single week in plain English. Thank you so much for watching, and I will see you in the next video.